So hi, we're here again with our wonderful patient who I thought is going to go for surgery, but apparently she doesn't have to go for surgery. So what happened?
I was scheduled already for surgery January 22, but then I saw my surgeon again January 9, and he assessed me. He told me that my symptoms really improved, and so that the surgeon told me that I don't need surgery. I just continue physiotherapy and do a lot of exercise.
So that's proof to you that physiotherapy works, even though I thought for sure she needed surgery because the herniation was such a big size. So I didn't think it was going to go back in, but it is going back in and she's feeling better. And now we're going to do some induction therapy with some squatting to strengthen her core. So therefore, we're moving more to active therapy. So she has strengthening her back and core. So this continues to get better, okay?